We're going to look at the stand pivot sit transfer and how it impacts not only the healthcare worker, but the patient resident. This particular transfer occurs when getting someone off the toilet, possibly to a wheelchair, or back into bed, in which safe patient handling equipment is not available. We're going to look at specific areas of the body that may be injured during this transfer, one being the lower back, the disc in particular. A lot of times people don't realize they're injuring their lower back because in the inner part of the disc, the annulus, does not have a lot of pain receptors. Therefore, you can cause micro trauma to that area, and it's not until the disc itself is deformed either through a bulge or herniation that the healthcare worker may experience pain, stiffness, a loss of movement. In looking at this particular transfer, the healthcare worker cannot get very close to the patient resident. In fact, it's hard for them to maintain the curve in their lower back, getting close enough for this transfer. Therefore, they put their back in a very compromised or awkward posture. Another area in the body that is injured during the stand pivot sit transfer is the knee. And we're going to do this transfer, and you're going to see that during a transfer in which the patient cannot move their feet, there's a torsional strain placed on the patient's knee as well as the healthcare worker. This can result in a meniscal tear of the knee in which it doesn't heal, and over a period of time can set both the patient and the healthcare worker up for degenerative changes in the knee joint itself. So, in looking at this transfer, you're going to see that, first of all, that the healthcare worker puts their lower back in a compromised position while trying to guard the patient's involved side. In this case, I'll be guarding the patient's right knee. So I put my legs in between her legs. I ask her to lean forward while trying to grab the gait belt. At this point, a lot of times the patient, to get their stability, will try to grab onto the healthcare worker, thus causing a possible injury to her shoulder while trying to jerk forward to stand, or even the healthcare worker's lower back. So we're going to put her hand here so you can see this. We're going to try to stand her up. As we stand, you can see the leveraging on my spine if she does not have good trunk control. And then what we're going to try to do is pivot into the chair while stabilizing or blocking her right knee. Reach back for the chair. Notice in this position the twisting of my spine, the rotation of her knee as she goes to sit. Over a period of time, what can happen is, due to this twisting of the knee becomes swollen. It also can be very painful and present with a loss of motion.
Okay, in summary, as you can see, that pivot transfer that you witnessed is a perfect example of the type of transfer that's getting us injured. It's loaded with risk, and it's loaded with risk to all three of the joints that Bob was talking about: the shoulder and neck, the low back, and the knee. The same injury that occurs to the patient occurs for the healthcare worker. So it's important to recognize that it is a manual lift transfer. Even if the gait belt's on, many times we see the healthcare worker go underneath the joint of the shoulder and lift and leverage that load using the shoulder of the patient and using their own shoulder. So the pivot transfer, in summary, is one that can only be done if the patient can stand, bear their weight, control their trunk, move their feet, and take steps. And the healthcare worker is a standby person giving cueing and contact guard on a gait belt. If it's anything more than that, it is a manual lift, and that's what we see across the board in every setting: hospital, nursing home, home care, group home, and school with special needs children. So what we'd like you to consider is looking at all of the devices we showed you today that can replace that pivot transfer.
Often what we find in healthcare settings is that a patient buckles, a patient falls, or a patient is saved from buckling. 90% of the time, the healthcare worker is the one who gets injured. We find that with good, solid assessment, we can prevent these incidents of a patient buckling. It's a matter of taking some time and assessing how well that body is ready to bear weight and move. So what you're going to see in this clip is Bob is working with the patient to assess their ability for readiness to stand and bear weight. This egress out of bed can take a very short time to determine how safe the maneuver will be. So the bed is put in a good transfer height, which means the patient's feet are on the floor and they can stabilize. He's checking balance. As they weight shift, are they able to hold their balance? Remember, if a patient doesn't have trunk control or sitting balance, they are not ready to stand, and they are definitely not ready to walk. Bob is testing the strength throughout the leg, having the patient push down on his hand. He looked at how well the patient could lift their leg. If the patient in a seated position can't lift their leg, then the patient is not ready to bear weight. Proper footwear is always key to helping that patient stay stable and up on their feet. Always use a gait belt if you're going to give any kind of contact guard to that patient. Unless they are independent, a gait belt should be on. The gait belt is not a lifting device. It's a device used to help cue and stabilize your patient. Worn low and around the center mass of the patient's body, it'll give a nice level of support for the caregiver with a safe place to put their hands. As you're assessing your patient for readiness to stand and bear weight, you need to remember that they should be using a device. They're either going to use a walker, a cane, or the side rail to help them stand. You do not want to pull them up to their feet. Caregivers positioning themselves with good body mechanics, close to the patient as possible, cueing that patient to stand by pushing up. You notice that the patient was not lifted by the gait belt. Continue to talk to that patient and assess. Let me see you move your feet. Let me see you march in place. All are indicators that the patient is ready to bear their weight and walk. If a patient can't do that, you're very close to the bed, and the patient could be sat back down. Assessment and taking your time to determine how well this patient is ready to move is going to prevent a lot of accidents and prevent a lot of incidents of patients buckling. Notice that patient did not take steps until we were sure that they were stable and able. A task that is loaded with risk is repositioning. It can take up to 2 and 4 people to reposition somebody manually. In a safe patient handling environment, we assess on the best way to reposition a patient by using the tools and the strategies that are in a comprehensive safe patient handling program. A sliding patient can pose a lot of risk to the patient and to the caregiver. So in this example, we're going to show you how a sit-stand lift can be used to lift a patient just enough to reposition them. Of course, if the patient does not fit the criteria at all and you're afraid to use a sit-stand lift, you're going to want to put a sling under that patient and use a full mechanical lift. But many times you can reposition with a sit-stand lift and get a pillow or a new cushion under a patient that'll stop them from sliding. In this video clip, we're going to use a device called a one-way slide. There's many different types on the market. And this is an example of a device that helps us keep a patient stable in an upright position, and it prevents that continuous sliding that some patients have. When you assess a patient out of bed, you want to make sure that you understand their out-of-bed tolerance, what's the best way to position them, what's the best way to provide pressure relief, and then you also have the option of preventing sliding using a one-way slide. So what we're doing in this clip is we're just lifting this patient high enough to put the device under them, and then we're going to put them back in their chair. This is a perfect example of repositioning a patient without manual exertion. The use of equipment quickly and easily safely puts that patient back into the chair and into a good position. Another safe patient handling tip could be that you can take your sit-stand lift, stand your patient up just high enough to put a sling under them. Once you have the sling under them, you can detach them from the sit-stand lift and then transfer them with the full mechanical lift if that's what's needed.